Now we'll face the ultimate autoimmune antagonist. We'll be talking about systemic lupus erythematosus, SLE. This is the prototype of autoimmunity. If you understand lupus, you understand the entire concept of the body turning against itself. First, the origin story. Why does this happen? It comes down to a failure of tolerance. Look at the formula on the screen. The trigger. You take genetics, specifically HLA genes, and add the environment like infection or UV light. This causes a chain reaction. Central tolerance fails, then peripheral tolerance fails. As I always say, when both defense systems fail, we get autoimmunity. How does the enemy attack? Step 1. The defect. The body fails to clear apoptotic bodies. It's a waste disposal problem. This leaves nuclear DNA exposed. The body sees this DNA and creates anti-nuclear antibodies. This leads to two types of warfare. Type 3 hypersensitivity, the clog, immune complexes deposit in the kidney and skin. And type 2 hypersensitivity, direct fire, antibodies attack RBCs and platelets. Now let's do some reconnaissance. How do you spot the enemy? We use the classic mnemonic SOAP brain MD. S for serositis, O for oral ulcers, painless, A for arthritis, non-erosive, P is for photosensitivity, B is for blood disorders, R is renal involvement, which is critical, A is ANA positive, I is immunologic, N is neurologic, for example seizures, M is malar rash, the butterfly rash, and D is discoid rash. Forget the old rules. We are using the update patch, the 2019 EULAR or ACR criteria. Think of this like a video game. Level 1, you must pass the entry level, the gatekeeper. Level 2, you must collect points. And level 3, you need a score of 10 or more to win the diagnosis. So let's begin with level 1, the gatekeeper. The test is ANA, anti-nuclear antibody. Here's the rule. If the ANA is negative, stop. It's not SLE, game over. If the ANA titer is more than 1:80 on HEP2 cells, proceed to level 2, which is collecting points. We assess 7 clinical and 3 immunological domains. The golden rule here is, you can only count the highest weighted item in a domain, don't double count. Rule of attribution, don't count a fever if they have malaria. It must be due to lupus. Let's look at the point values. Constitutional or fever is 2 points. Hematologic, autoimmune hemolysis is big 4 points. Neuro, seizures give you 5 points. Mucocutaneous, acute cutaneous lupus or malar rash is a heavy weight worth 6 points. Moving to the body, joints, synovitis is 6 points. But here's the boss fight, the renal domain. This is the most common cause of death. Look at my cheat code here. If a patient is ANA positive and has class 3 or 4 nephritis on biopsy, that is 10 points. Automatic win. You don't need any other symptoms. Diagnosis confirmed. Speaking of the kidney, you need to know the morphology for the lab exam. Class 1 or 2 is mild, class 3 is focal, and class 4 diffuse. These are the severe ones. Microscopically, look for the wire loop lesion. This is the immune complex deposition thickening the capillary wall. Now for the lab report. We check for antiphospholipid antibodies and low complement C3 and C4. But the heavyweights 6 points are the specific antibodies anti-dsDNA or anti-Smith. Memorize this cheat sheet. This is high yield. ANA is the best screening test. It is sensitive but not specific. Anti-Smith is highly specific. Anti-dsDNA is also highly specific and correlates with disease activity like kidney damage. Antihistone is specific for drug-induced lupus. Remember the drugs procainamide, hydralazine, and isoniazid. ANA positive plus a score of 10 or more equals SLE.